just been so excited to be here and also to hear a lot of the other speakers. This has been a wonderful day. I want to talk to you today about a condition called depression. Now, I think everybody here has had some degree of sadness, the normal ups and downs. But I want to tell you about major depressive disorder or clinical depression. I think this is well captured in various places in the Bible, but one place is in Job. Many of you know the story, but just a series of terrible things happened to Job. And Job says, even I lie down, I say, when shall I arise? And the night be gone. And I am full of tossings to and fro unto the dawning of the day. My days are swifter than a weaver's shuttle and are spent without hope. So that my soul chooseth strangling and death rather than my life. It's a condition of preferring death over life. It's a condition of just abject misery. Some of the conditions, some of the symptoms of the condition of major depression are just across the board, affecting all of the different systems of the body, not simply sadness subjectively, but also affecting hormonal systems, affecting appetite and cortisol. Connections in the brain are altered. Your ability to think and focus and concentrate are affected. Feelings of worthlessness and guilt are present all day long. And thoughts of death, as Job described, thoughts of death and sometimes even of suicide. Ideas of wanting to die or intending to die or even planning one's own death are sometimes omnipresent. There are studies of trying to capture, it's a rather morose task, but trying to capture and quantify exactly how miserable are various conditions. So there's an entire field that goes about doing this. And so if you happen to be a part of this very morose field, you have different quantifies. You've quantified these various things by what's called disability weight. So imagine or think back to the last time you had the most miserable flu of your life, the most sick you could ever possibly remember being. And that gets you to about a disability weight. That day was worth about 0.15. Now, these things are all relative, so it's so every day you live there, you're losing out on 15% of life, is sort of how they're quantifying this. Now, imagine, who's ever heard of a heart attack or having a heart attack? This is like one of the worst things we can imagine. This is actively having a heart attack. Like that's a really bad day. So you're losing about 40% of life on that day that you are actively having a heart attack. Now, major depressive disorder of moderate severity is about actively having a heart attack. It's about as bad as having a heart attack, but you have that every single day. You have that day after day after day, and it gets exhausting. It gets crushing. Now, here's another condition that nobody hopes to have, is dying of cancer without treatment. So no pain meds, no medication to make it better, terminal stage, metastasized everywhere, you're actively dying. That gets you to about 0.55. Severe depression is worse than that. Every day, sometimes for years. And so when we think about people who are in this condition, who think, I want to die, I want to kill myself, and Job, I want to end my life. On some level, we can say, no, we value life, or we want to keep on living, but the emotional appeal of not being alive is powerful. And this is what has really captured my heart and my attention and my passion. And it's not just, and it would be one thing, and there are conditions that really capture your heart that are rare. There are rare conditions that are extremely painful, extremely difficult. But the other thing that's really astonishing and upsetting about depression is that it's extremely common. About 1 in 20 people has depression. And these are statistics back from the 1950s, and it's been something that's been plaguing us as far back as we've looked. And so this is what has become my passion, is trying to address this condition. As a psychiatrist and medical doctor, the thing that I want to do with my time is try to address this condition. And the good news about addressing this condition is that there's a lot of hope. There's a lot of things that have happened over the past several decades that I use on a daily basis with my patients. I've set up a clinic in Sunnyvale just down the street called Acacia Mental Health. And it's a holistic treatment. And so one of the things that's part of a holistic treatment is medications. So in 1957, they started to produce and sell a drug called imipramine, one of the tricyclics. You can see the 3 rings there. 1, 2, 3, tricyclics. And then Prozac, fluoxetine, in 1986. And with the development of the SSRIs, the antidepressant medications, we've seen this incredible adoption, more than almost anything in the history of psychiatry. We've seen this incredible access to medications that are effective at treating and bringing down depression. These medications that are safe, that are able to help the symptoms of depression and help people get back to normal lives. And I have plenty of people that come to me, we start a medication and that's it, that's all they need. They feel better, they're able to go back to their families, go back to their lives. This condition of suffering is improved. But not just antidepressants. There's also been developments in the fields of psychotherapy. I also practice psychotherapy. And so effective ways of providing therapy for people who are suffering in ways that are more rapid and effective. So the guy on the left is Aaron Beck, and the guy on the right is David Burns, 2 of the leading lights in developing cognitive behavioral therapy, a way of addressing the negative thoughts and guilty ideas that people have with depression. And so the great news about that is that it's something that people can get better, sometimes in a matter of a few months, sometimes without medication, sometimes together with medications. And so you have these new techniques that are getting better and better every day at addressing depression. Now, the thing that's even more exciting to me, though, is the most exciting thing to happen in my career, in my opinion, is the development of new ways to treat depression. So I work with a machine called the Transcranial magnetic stimulator. It looks like that, and you put it over the part of the brain that isn't working as well. And you, by using magnetism, you return the brain to its normal pattern of firing. You use magnetic induction, and it has minimal side effects. So unlike a lot of things and other sorts of treatments, you're able to go through this treatment and then stay better. Antidepressants usually work as long as you take them. With the magnetic stimulation, you go through it and you stay better. It's been incredibly exciting. And the great news is, when medications don't work, TMS does. And so through a course of TMS, people who've tried, even 4 medications, who've tried one medication and then another, and then another, and then another, go into TMS, and 4 out of 10 of them get all the way better. They go back to their lives. They have no more symptoms, and they stay in this period. And an additional 20% have substantial improvement. But not just that. This is a very new and exciting treatment, and so there are new ways of doing it. So we're starting to do this at Stanford. One of my colleagues, Nolan Williams, has a new protocol. Increase the dose. Do more of this, more time under the magnet, more time with this treatment. Do it intensively over the course of 1 week. And again, people, and we're getting incredible results. Maybe 80% or more of people who have just been suffering for years and years sometimes, who've tried sometimes dozens of medications, go into complete remission with this new kind of treatment. And so here's a quick video. Let's see if this plays.
I had lost all hope. But I remember about 2 weeks into treatment waking up and it felt as if things were brighter. There are no words that truly encapsulate how grateful I am to have walked into this office, to have the level of care at a time when I had given up so much hope in my life. For anyone that's considering TMS, I would say it is a life changer.
Her name's Amanda. She came in, she had tried multiple medications. She was suffering greatly. Her family was falling apart. She had, like Joe, she had real things that were going on in her life. Her family was having difficulty. She was having difficulty. She had troubles with substance abuse. She was having a very difficult time. She got treatment and she got better. The depression went away. The problems stayed. The situation in her life wasn't any different, but she had the power and ability to respond to those things. So at our clinic, we've got an algorithm. With all of these tools combined, we start with, this is a model I made of 1,000 people. 1,000 people start depressed. and we go through the different stages of treatment, starting with psychotherapy, and we get about a third of people all the way better, a third of people to respond or have some improvement. And then by addressing several more medications, we're able to bring that number to most people, about 80%, having substantial improvement. And then we do regular TMS and then accelerated TMS, and we're down to almost everybody getting better. So we're moving in the direction because of these great technologies, because of what's available in psychiatry, of helping almost everybody get better. And so, looking ahead, 1952, before all of these advances were available, 5% of people were depressed. And in 2017, with all of these treatments and medications and TMS, 7%. What happened? What's happened over these past 7 decades? And you say, well, maybe it's just we're catching more of it. Maybe we're better at diagnosing it. This is the same scale given to college students back to the 1940s, and it's been increasing. This is 63,000 people over 60 years, and it's increasing. Here's suicide rates in the United States, increasing. So, what's happening? What's happened? I think the answer is that the world, in a lot of ways, even though we have these more aggressive treatments, has become more depressing. And maybe that goes without saying. But in some ways, the risk factors for depression, the things that predispose to depression, have increased. Here's where we eat. More fast food and more eating outside the home. So our diets have become quite a bit worse. In 1985, we had 3 people that we used to be able to talk to about important matters. In 2004, even before social media, it had dropped to 1. The perfectionism in college students has been steadily increasing, both judging our college students judging themselves, feeling judged by others, and, maybe not surprisingly, over the past decades. And so I guess the question I have for us is, how do we make our world less depressing? Yes, there are things that I can do, and it is my passion to do, is to continue to push the treatments for those people who are in the most depressing circumstances, people who are very much in the depths of major depression. But I think the call today that I have for you is, what are ways that you can make the world just a little bit less depressing? Is there something in yourself or with your friends? Can you go from this to this? When you have your cookouts, when you make food for yourself or your family, can you throw something healthy in there? Can we go from valuing wealth and money to and security? I think oftentimes we put a lot of we're not greedy per se, but we have a lot of value in financial security. But changing that to caring for the poor and caring for the needy. There's a lot of other ways to do that. What about shame and judgment of others? We all, apparently, according to the statistics, we're doing this more than we have in the past. Is there a way, perhaps with our students, perhaps with teenagers, perhaps with our coworkers, ways that we can go from judgment of others to acceptance and compassion? And are there ways, and maybe this pairs very nicely with the last talk, are there ways that we can go from loneliness to community? Are there ways that you can invite other people out just for dinner? Have a meal with somebody. It's like we're in a famine of social connection. Is there something that you could do to provide food for not just literal food, but social food for people who are lonely and isolated? And so, as we who are professionals continue to do our best to advance the treatments and technologies, we also want to ask you to find ways and think about ways to try to make the world around you, both globally but especially locally, to be just a little bit better. Together, we can build a world without depression. Thank you.